Dentistry 101. The healthy teeth has 3 layers. The enamel on the outside, which is like a tank armor. The dentin, which is the middle layer, it's like our plaster walls. It's hard, but not as hard as a tank. And then the center layer, which is the nerve and blood vessels in the tooth. It's like cotton candy. If you just touch it, it shrivels. So when we get a cavity, it's either on top of the tooth or on the side of the tooth. The doctor will clean this out and place a filling in there. It could be a white filling or a silver filling. When the bacteria and the cavity gets too deep into the nerve, it starts to kill the nerve and it will cause an infection. At that point, we would clean it out and fill it up. That's called a root canal. A root canal is nothing more than a filling that's deeper inside the tooth. That's all it is. The final stage for a root canal is to put a crown, or most people know it as a cap, on the tooth. That's to help it to stop breaking as we use the teeth. Does anyone have any questions about that? The second thing that we treat in this office is gum disease, which is called gingivitis. And that will lead to the loss of our teeth because what's supporting the teeth is starting to die away. The gums and the bones supports the teeth. So in our lifetime, we're going from healthy to cavities to root canals to crowns. Hopefully, we stop the gingivitis when we find it. Okay. So you understand the process of these fillings and these crowns. The treatment for gingivitis or gum disease is to do a deep cleaning where we go below the gum and clean all that debris out. That's called a scaling and root planing, also known as SRP. Okay? So, this is all called gum disease. So if someone has gum disease and we're looking at their plan, chances are they have SRPs planned in for their treatment. Does that make sense? Mm-hmm. Does anyone have questions about that? Ashley?
No, sir.
Do we have anesthetics when we do deep cleanings?
Yes.
Okay. Why is that?
Anesthetics?
Yes. Because we're cleaning below the gum line and it will hurt if we don't have anesthetics.
Okay.
Okay. So what is the difference between my 6-month cleaning, Ashley, and my scaling and root planing cleaning? Our 6 months cleaning is when we are cleaning above the gum line every 6 months, right? To keep the mouth clean. And our deep cleaning is when we go below the gum line to clean out all the bacteria and the debris that's below the gum line.
So you have to schedule 2 appointments, or can you get it all done at one time?
Regular cleaning, 6 months cleaning, and scaling and root planing are never done at one visit. You do 1 appointment for the regular cleaning and 1 or 2 appointments for the deep cleaning. Now, after you do the deep cleaning and you've gone through and you spent an hour and a half to clean the entire mouth under anesthesia, you don't want that to continue for your patient 2 years down the road. So you have them come back for a perio maintenance, which is an opportunity for the hygienist to go in and make sure that this buildup hasn't began again.
And she'd be checking those numbers, like you said, anything over 3.
Correct.
And how often is it after the SRP?
Generally every 4 months
For the perio maintenance?
for the perio maintenance. Now, if after 2 or 3 perio maintenance, the patient seems to be in good condition, there's nothing to clean after 2, 3 months, 4 months later, then they have graduated to every 6 months cleaning, because now they've demonstrated that at home their flossing and brushing is adequate to keep them from having gum disease. Okay?
May I ask a question?
Yes.
It's a billing question.
Yes.
So if the 3, anything over 3 indicates gingivitis,
Correct.
why is it the insurance won't cover an SRP unless the number is a 4?
Well, what's beyond a 3?
A 4.
Correct.
But I mean, why would they make it 3?
Okay. 3 3 is how they select 3.
Yeah.
Because 3 is, by research, is how deep you and I can clean at home with our floss and toothbrush.
So the chance, okay.
If you have 4, if you have more than 3, that means that there's an area down here that has bacteria that you can't get to as a patient.
Right.
And so you have to have a dental professional get down there, clean that out to make it at least a 3 or 2.
So the 4 is the necessity point.
There's other necessities, but in terms of pocket depth, that's one of the measurements that we use to determine have you improved or have you gotten worse with your periodontal disease.
Okay. And I know we always bill out for the whole quad, but sometimes the insurance will come back and say, no, only 2 or 3 teeth actually needed it.
Okay, so we're getting into the nitty-gritty of that. I'd like to
Okay.
save that for another time.
Okay. Agreed.
Any other questions? Ashley, do you have any questions about deep cleaning? How long before you go without a perio maintenance?
4 months.
Very good. Do you do a deep cleaning, which is also known as an?
SRP?
Do you do that the same time that you do your 6-month cleaning and checkup?
No.
Why is that?
Because the 6 months cleaning is above the gum and the SRP is under the gum,
Mm-hmm.
and they have to,
We need more time to clean below the gum,
below the
and we need to anesthetize the area. I apologize if I used the word pain earlier. It is painful if you don't get anesthetized, but in SRPs generally you anesthetize. Oh, will it hurt, Ashley? No, it won't hurt, Mrs. Smith. You'll be numbed the entire time. People will ask that, oh, my brother-in-law had deep cleaning. He said it was terrible. It does take some time, however, you're numb the entire time. Any other questions about deep cleaning, about cavities, root canals, and crowns? Ashley, as a general rule, dental insurance covers crowns for how long, and is there a time limit on how often you can have them done?
There is a time limit.
What's that time limit? Generally, it's a 5-year. So
Right.
if you've had the crown done, if you had the same insurance for the last 5 years and you've had a crown done within the last 5 years, they won't cover another one.
For that tooth
For
or
that
all in
tooth, for that
general?
tooth, for that
Okay.
tooth, for that one tooth,
Per tooth.
per tooth. So that's a little tidbit that I've picked up in my years of dentistry. Billing side that I'd rather not know. Any other questions? Okay. So the reason why I wanted to start here is because this provides the basis for your dentistry. Wherever you go, South Africa, Norway, Iceland, Antarctica, teeth are the same. This is what you're going to have. As it applies to billing, I was talking to our staff earlier that the insurance corporations, especially in dentistry, is very strict. And for that reason, you're fine. And for that reason, there are things that you need to have in order to demonstrate why you're doing that treatment. If a medical doctor in the ER room intubates you, takes $9,000 worth of CTs and MRIs just to evaluate and assess the pain you're having in your jaw and tell you, hey, you have a dental abscess. No one goes after that doctor. No one questions that doctor. If a dentist takes out your tooth, doesn't have an x-ray, doesn't have any documentation of your pain, of your swelling, of how it's kept you up late at night, and have you sign off on these procedures, then that doctor gets put into jail, loses his license. That dentist does. Okay? So the first thing is x-rays. Our x-rays, where's our book? Here we go. Our x-rays we look at our x-rays and we see what's going on. Combine that with the patient's presentation. We determine a diagnosis. You're having pain on the center tooth to the left of your midline. That's number 9. You have a cavity in there and it's killing the nerve and you need a root canal. If I don't have an x-ray of the tooth before and after the root canal, then I never did the root canal. Okay? So, any root canal patients you have, if there's not an x-ray within the last 2 or 3 months of the tooth before, you need to have that. Chelsea comes in with a toothache today, and you look at her last visit, she has a limited exam on that day, and you read the notes, doctor says lower left quad pain 8 out of 10, and there's no x-ray. Then before Chelsea comes back for the root canal, which she's scheduled 2 weeks from now, after antibiotics, after she takes her antibiotics, you need to put a note in that patient's schedule block. Please take need x-ray of number 3. Need pre-op x-ray number 3 or number 1930, whatever it is. Okay. When you have a crown that's being done on a tooth without a root canal, need photo of number 3 before crown prep.
Okay. So the oral picture.
Yes. Need photo. So it's either x-ray or photo. In our office, we use those two to document our treatment. Okay? So, number 1, you have the doctor's note. What do you need?
Stop.